Good morning, ladies and gentlemen. Before we'll begin, I will describe myself shortly. I'm rather tall with dark blue suit. My hair used to be black. Now, with my daughter growing up, they are becoming more white every week. And my name is Rafał Sakowski. I'm the head of the Urban Culture Institute City of Łódź that is responsible for your experience today, so I hope it will be terrific. It's my greatest honor to welcome you on the conference Culture for Health and Wellbeing that we organize together with Culture Action Europe and Culture for Health platform. Over the next 2 days, we'll have the opportunity to discuss a very pressing issue, how culture can help with health, especially mental health, that is so dear to us that we dedicated our bid for the ECOC 2029 to this subject. I'm very happy that among guests is so many noble people. To make it brief, I will just introduce a few of them. Monica Urian, that is representative of the European Commission. Nils Fietje, representative of the World Health Organization. Senator of the Polish Parliament, Agnieszka Gorgoń-Komor. Ms. Natalia Kępa-Paplińska, IMC member from Culture and Heritage Ministry. Kornelia from Culture Action Europe. Paul Milbank from Government of Bailiwick of Jersey. Madame Joanna Bojczuk, Marshal of Silesian Voivodeship, and of course our Mayor Jarosław Klimaszewski. And last but not least, I want to thank Witold Mazurkiewicz, who is the host of this magnificent building. And of course, all of you that day out and day in care about the well-being of others, regardless that you work for culture, or social departments, or servicemen, all carers that care about others. Thank you that you dedicated your time to be here, to discuss, to share knowledge. And I hope when we'll finish the conference tomorrow, you'll be asking how to get involved, what we can do better, what we can do next. I want to say thank you to every who supported our conference. We have privilege to have the patronage of Ministry of Culture and National Heritage, Minister of Health, Marshal Office, Wojciech Saługa, from Silesian Medical University, and our Mayor of Bielsko-Biała, which I will welcome to the stage.
Dzień dobry Państwu, witam
Good morning, and ladies and gentlemen. Let me welcome you in my favorite city, Bielsko-Biała, the first capital of culture in history. The subject of this conference is a natural consequence of our attempts for the European capital of culture. As you know, we got to the finale and Lublin won that title, but we also have won something very important, the involvement of our citizens, the ability to focus on our common goals and engaging them in cooperation and cooperation between the institutions of culture, this experience, the international contacts that we managed to acquire, and the entire potential shall be continued. And this conference is the first step towards it. We realized, because that was the principle of standing for that competition, that we needed to find a problem that is common for the entire of Europe. And on the basis of relevant studies, we did see that culture can affect health, mental health, and dealing with the world we have nowadays, as complicated as it is. We all know that the mental problems in our city, country, and in Europe and all over the world in this difficult time is a problem that we need to tackle and solve it, not just bury it, because it would not bring any positive results to the development of societies in general. So we focused on that, and we decided that in our city we shall be, and I would like us to be pioneers, how we can affect well-being, which affects, has proven the well-being of societies. And all of us work for the people, as the president and the mayor see it as a priority. This is something that is not rocket science, but I would like to thank all of us who accepted the invitations from various countries, institutions, through universities, international think tanks. I hope that all of us are going to leave that place richer in knowledge, in experience, and hopefully we shall become better people, which is not going to be an obstacle, but it's going to assist that. I would like to thank for the patronage to the Minister of Health, the Minister of History and National Heritage, European Commission, and I hope that each of you would take something from this conference, that you will find something you can bring on into your lives, your organizations, and hopefully you enjoy Bielsko-Biała. And if you have enough time, go and do sightseeing, because there's plenty to see. Thank you very much.
So before we'll proceed to the first panel, I have a couple of technical information. All panels are recorded. We'll share the video after. I want to welcome Gosia Spasiewicz-Bulas. She's a graphic recorder, so even in the break, we'll already have graphic representation what have been said. We have sign language interpreter, so I hope that we can make this conference very accessible. You already know Edita and Alexandra and Ola, and we are here for you. So if you have any questions, don't hesitate. We'll try to solve all possible challenges or just answer your questions. And before, in the morning, we have more lecture time, and this is just a part of the conference. We encourage you to experience Bielsko in 3 cultural events that happened today in the afternoon, which is a guided tour in animation film studio, curatorial visit to Behavioural Art Gallery, or Anashim concert in Jewish community. Everything is under QR code over there, but we can ask. And in the evening, we have a gathering in the airfields, in the hangar, that we can network, warm up with the tea, and listen to the music. But without further delay, I want to invite you for the first panel, showcasing evidence on culture contribution to health and well-being. And I want to invite to the stage Monica Urian, Policy Officer at European Commission, Kornelia Kies, Head of Culture and Health at Culture Action Europe, Paul Milbank, representative from the government of Jersey, Marta Ciesielska, senior advisor at Marshal office of the West Pomerania region. Our moderator will be Nils Fietje, technical officer in Behavioural and Cultural Insight Unit at WHO Europe. So I will pass the floor to you and enjoy. Thank you. Thank you. Thank you.
Thank you so much for the introduction. Thank you for the invitation. It's a real pleasure to be in Bielsko-Biała. Already with yesterday's dinner, the wonderful venue that we're in today, and I'm very much looking forward to our experience at the hangar tonight as well. My name is Nils. I'll be guiding you through today's panel. The panel has already been introduced, so I don't want to spend too much more time on the introductions. We have some experts, some wonderful experts with us today who come at the topic of evidence from different perspectives. On the one hand, there is Monica and Kornelia and myself who give a bit of a political, a research-based and an EU-based overview. And then we have Marta and Paul who are going to really dive into concrete projects and give you a bit of a flavor of arts and health projects on the ground. So with that being said, I will give you hopefully a very brief introduction and say a little bit about what WHO is doing in the space, and then I'll hand over to my other speakers. Next slide, please. So I'm not sure everybody knows what arts and health is. I'm going to just say a few words about it. Arts and health is a space that has a deep history. Perhaps some of you may be familiar with art therapies, music therapy, drama therapy, all of which have a rich history of over 100 years. But in the last few decades, probably around 40 years or so, there's been a broadening of that field to also include looking at arts interventions, arts activities for health purposes. And that might include things like passive activities, where you might be reading for yourself, or you might be experiencing a theater, a play, like you might be doing here. And evidence is beginning to show that that has a health effect. But there is also an increasing number of activities, arts activities with a therapeutic intent that are being designed, where we can show, for instance, that singing can improve lung functioning for people who are suffering from long COVID, for instance, or dancing can support gait and movement for people who have difficulty after post-hip operations. So there's a wide range of activities that are being designed, that have been designed to show that they have health outcomes. And then finally, we're also moving into a space where, and I'll say a little bit about this later, where it can be shown that just the engagement with arts, just the engagement with culture can actually have a health benefit. So just by participating in a dance class without necessarily having a health intention, or just by singing in a choir, just by reading a book, you're generating health effects, and I'll say a little bit about that in a moment. But I didn't want to skip. If we could just go back one slide for a second, I didn't want to skip over the actual quote, because I think what this does really well is another dimension of why the arts are important to health, and that's it because they help us express things about health in a different way. This is a quote from a famous French painter and sculptor called Georges Braque, who says that art is a wound turned into light. And there's something we gather from that poetic insight that you don't gather from scientific or medical research. So if we could go to the next slide. I'll breeze over these slides quite quickly. Most of them have QR codes on the side. So if you want to know more about this, the slides and the documents that I'm referring to, do take a picture, and then you should be able to find the QR code and find the resource. But our journey started with the publication of a big scoping review, which we published in 2019. It brought together a lot of literature, over 3,000 discrete research papers, and tried to provide a bit of an overview of arts and health research. And it demonstrated, I think, that there was a lot of activity in this space, that there was a lot of good evidence in this space, and that throughout health promotion, illness prevention, and the treatment and the management of disease, you could find evidence of research that was having positive health outcomes. So that was our starting point. Next slide, please. And from this, we generated some policy recommendations. Again, I won't go into these in much detail. I'll encourage you to have a look in your own time. But one of the critical recommendations, and this is quite obvious, was for this space to succeed, for arts and health to succeed, we really needed the collaboration of the arts and the culture sector together. Unfortunately, quite often we find ourselves in a situation where arts and health is pushed from one sector to the other sector and then sometimes falls in between the cracks because nobody's quite sure who should be responsible for funding it. So in order to make arts and health work, we need that collaboration. We need hospitals to bring in artists. We need cultural institutions to think about health strategies. We need both of those sectors to work together. Next slide, please. One of WHO's first kind of forays into arts and health was through an actual project that we managed called Music in Motherhood. This is an intervention that was originally designed in the UK. It has really a substantive evidence base behind it. It's based on a randomized control trial. So we were quite confident that this was an effective intervention. And it's for mothers who are suffering postpartum depression. It incorporates 10 weeks of singing with a group of mothers who are experiencing postpartum depression. And the evidence shows that while postpartum depression usually declines anyway over time, with the use of this intervention, it declines much more rapidly. We trialed this we took this intervention, the protocol, and we wanted to see what happens when you take a culturally grounded intervention that's based on music and you try to run it in other cultural settings, so other linguistic settings, other musical taste settings. And we ran it in Italy, in Denmark, and in Romania. We translated it into 4 languages. And we learned a lot along the way about how you localize and how you sensitively take one intervention from one place to another. But we also learned that it's possible. We learned that the effects of the intervention were just as good in those settings as they were in the UK. Next slide, please. So the other thing that I wanted to just briefly familiarize yourself with, because I will be talking about it in the panel, is a process called, or is a health systems innovation called social prescribing. One of the other challenges for arts and health activities is that you need to find a way to bring people who are experiencing health challenges into an arts ecosystem or an arts and health ecosystem. And in some places, this is being done through something called social prescribing, whereby an individual might present to a family doctor with a certain health challenge. The family doctor might make an assessment that this is not a biomedical challenge. It's not something that can be treated with drugs or even surgical intervention. And they might then decide that the best course of action for this person is to treat them via an arts and health or some other form of community referral or a community intervention. That person would then be referred to, in the UK it's called a link worker, a person who is familiar with this arts and health or social prescribing space, and would take the time to work with the patient and potentially refer them to an arts and health intervention as an example. This is a space that's becoming more and more relevant in the European Union in different ways. Some are calling it social prescribing, some are calling it arts on prescription, cultural prescribing, community referral. There's a lot of terminology around this type of mechanism, but it's beginning to change some health systems in Europe. Next slide, please. Here are some examples of social prescribing. I won't go into them, but just to say that they're really happening at all levels. They're happening at the local level in cities, they're happening at the national level, and they're also happening at the EU level as well. Next slide, please. I won't go into this very much, but just to say another big challenge of the arts and health space is that it is very fragmented. Even on a national level, often you find a lot of activities in small parts, but certainly at a global level, a lot of the arts and health movement is not connected. So a little over a year ago, the Jamil Arts and Health Lab was founded with the purpose of connecting internationally the communities of within arts and health, and also to some extent social prescribing, and WHO is collaborating with them to do that. Next slide, please. Again, just very briefly, we continue to be very active at WHO. We try to produce policy briefs. We've got a couple of policy briefs coming up, one on youth mental health, arts, youth, and mental health, for instance. And we also have an important series of research papers coming out in The Lancet. For those of you not familiar, The Lancet is probably one of the preeminent public health and medical journals in the world, and they've commissioned us to write a four-paper Lancet series on arts and health and the health benefits of the arts. Next slide, please. So this is my last slide, and this is what I started off with. One of the things we're really interested in researching now is the implicit, the inherent benefit of culture and on health. And that's because we want to explore whether engaging in culture and engaging in the arts is a type of health behavior, like physical activity, like eating healthily. And there's more and more data coming from places in the US and in the UK that are beginning to underline this and that are beginning to show this. So for instance, this graph here shows that for a sample of 60-year-olds in the UK who are culturally active more than once a month or more, that they reduce their likelihood of developing depression over the next 10 years by 48%. So these are the kind of statistics that we're beginning to unravel from longitudinal big data studies that'll hopefully be able to allow us to make the point that culture is not just a nice to have, it's of course a human right, but it is also something that fundamentally affects our health and our well-being. So I hope I've done my bit of giving you a little bit of a whistle-stop tour, a quick grounding in arts and health for those of you who are not so familiar. And now I'm going to hand over to Monica to tell us a little bit about, Monica has already been introduced as a policy officer of the European Commission, and she's going to tell us a little bit about arts and health, culture and health at the European Commission level. Over to you, Monica.
Thank you, Nils, and good morning, everyone. It's very important for the European Commission to be present here. And I want to thank to the Bielsko-Biała team who has welcomed us wonderfully since last evening, and particularly to Mr. Mayor. And to congratulate them for the bid for the European Capital of Culture. I know you didn't get it, but it's wonderful to see, first of all, that you dedicated so much energy to the topic that we are discussing today, and also to see this wonderful energy that brings so many different partners together, and to see that this continues, and it's going to give a new soul to the city, or to express this soul, because the soul is already here, as we already saw. Cities are a laboratory for experimentation. This is something that we see often in the European Union in all kinds of topics related to culture policy. And culture, health and well-being is not an exception in that. And therefore, it's important for us to talk to you and see what is going on, what are the new ideas, and get inspired, and also share a little bit of the experience that we have. And for me, I have the privilege to work in culture policy in Brussels, in the European Commission. I've done that since 2007. It sounds like a long time already. And since 2020, I've been in charge of this new file for us, which is culture and health. If you can go to the next slide, please. Now, of course, in terms of culture policy, just as health policy in the European Union, as you may know, we don't have a direct competence, so we have something that is called a support competence, which means that we support the member states to come together, to learn with each other, to share experience and inspire each other to go into a certain direction. And despite what Nils said, art being a form of expression of the human soul since the beginning of the human species, which I illustrate with this wonderful rock art painting, somehow during the time this connection, at least for policymakers, was lost. And I just added here a number of elements where you can see that there are culture policy documents at the EU level. There are, of course, health documents, and we have the Sustainable Development Goals, where we don't have culture, but we have health, but they are not connected. So now the work that we have at the European level is to connect them, and we are doing this, of course, in a partnership with all the other EU institutions and with regions and cities. I will have the chance to develop very briefly a few of these elements because time is short. So if you can go to the next slide. Now, in terms of culture policy, you may have heard about the new European Agenda for Culture, which was published in 2018. And this is really the first time ever when we included a connection with well-being. So in the past, the first European Agenda for Culture was published in 2007. And so this is like the second one, an update of the first one. And we always had the economic, social, and external dimension pillar. But this time, in this new agenda, we really included this connection with cohesion and well-being, which you see there in the middle. And this was an important step forward because, of course, it gives the message to policymakers at all other levels that this is important for us. And then it starts like a virtuous circle, what I would call it. If you can go to the next slide. And that was a European Commission document. Now, of course, as I said, we work a lot with the member states, and the Council of the European Union is very important in this process. Every 4 years, we have what we call a European Work Plan for Culture. And in this current one, the member states, together with the European Commission, because it's negotiated in common, decided that culture and health is really a very important topic. And this means that in one of the priorities of this work plan, which is called Culture for the People, we have a specific action on culture and health. So among the 21 actions of this work plan for 4 years, on which we work with the member states, which is like the sort of blueprint of what the EU is doing in culture policy, we have this culture and health action, which means that we have an expert group of the member states coming together to discuss this topic. I'm going to discuss this in a little bit more detail in a moment. And if you go to the next slide, I also underlined that even in the external dimension, because here, of course, we tend to focus on the EU dimension, although we do have in this conference, and this I appreciate very much, an external dimension. So we have this other priority called Culture for Co-Creative Partnerships, where we will work with partner countries, for example, Ukraine. And there, this topic of culture, health, and well-being, again, is highlighted. We had several actions on this issue, and also the role of culture and cultural professionals in the promotion and defense of democracy and human rights in fragile contexts. And interestingly, we have in this conference panels on these topics on forcibly displaced people, and Ukraine is part of that, and also on mental health and youth. So if I go to the next slide to give you like a brief overview, hopefully we have time to discuss after. What is happening in the work with the member states? We have this expert group where for the first time we put the experts from the Ministry of Culture and experts from the Ministry of Health together around the same table. Of course, it's a mandatory scheme, so member states are participating on a voluntary basis. We have almost all member states involved actively in this process. And it's very useful even at the national level, because sometimes people from the Ministry of Culture and of Health, they don't meet together on a regular basis. And also we can see how different countries of the EU have different experiences. Some of them are more advanced. Others are trying to develop policies in this field. Others have interesting pilots or experiments at the local or regional level, and everybody it's a win-win basically. We are working now on a report that will include a number of issues like how to deliver programs and policies on culture and health. What is the value in terms of social, economic, cultural and health value of this collaboration? Because of course we are still in the process of convincing, as you heard from Nils. And I'm very happy to say that we have the partnership with the WHO and also with Culture Action Europe in this field. Culture Action Europe, which was also the leader of Culture for Health, a preparatory action. Just one word about what is a preparatory action. This is a way for the European Parliament to give a specific budget for a project which is not covered by our usual funding schemes, and to launch an experimentation process. And this was a very successful one, where in 2020 we started to work on it, and for 1.5 years we built an incredible website, database, and so on. And I'm going to go maybe just 2 words about mental health, which is indeed in one of the panels. For the first time last year, we had an EU communication on, which is called the Comprehensive Approach to Mental Health in the EU. You may have heard that our president, Ursula von der Leyen, is very attached to this, and particularly on mental health of the youth. We know this is an enormous issue at the European level, and the political guidelines for the new commission that she presented a few weeks ago really re-emphasized this topic. But already last year, in her first mandate, we had DG Sante in charge of the health policy presenting this communication, where culture was present for the first time, and we are very happy to launch this new type of collaboration and to explore how to work more with the health sector based on this communication. And just to finish with this, of course, I talked a lot about policies, culture policies, a little bit about health. We could also talk about youth policies, social, and so on, but we don't have a lot of time. But policies and funding go hand in hand. So if you don't have the resources to invest in organizations that are able from both sides or from several sides, education also, youth, social sector, emergency support sector, the policies don't have an impact. So we have worked, for example, in our direct remit with the Creative Europe program to include culture and health and well-being as a priority in their calls. And this has worked really well so far. So we have cultural networks that are working on this. We have cooperation project working across the borders. And we have now the new cultural platform that you will hear about in a moment, which is also a premiere. But we have also European Capitals of Culture. You know, the current one in Tartu is working a lot on mental health and youth and culture. And we have EU prizes for culture, like the contemporary architecture. Architecture is an important contributor to health and well-being, and lots of other interesting resources that I'm available to share with you in case there is a specific interest. Thank you very much.
Thank you very much, Monica, for that overview, and congratulations also on the amount of on the fantastic work that you are doing and your team is doing to drive forward the arts and health and culture and health work. Next up, we have Kornelia. Kornelia is the head of culture and health at Culture Action Europe, and is going to tell us a little bit about what's going on at Culture Action Europe on this topic.
Yes, thank you very much. So I will not introduce Culture Action Europe now, because in the next part I will have a bit more time than 7 minutes. So if you just go to the next slide, I will let you know a little bit later which organization I'm coming from. Basically, it is a European cultural network, the only cross-sectoral cultural network that is covering basically all sectors of culture. And what we are doing is we are trying to understand what the cultural sector would like to transmit towards the European and international institutions. And we also try to decode the language that the European institutions are using to the cultural sector's language as well. So that's what we are doing. And Monica was mentioning the Culture for Health project. We were basically one of the selected implementers of the Culture for Health project, but it was not only Culture Action Europe implementing it. You see all the logos down there. We had Cluj Cultural Center, Društvo Asociacija, Central Denmark Region, Northern Dimension Partnership on Culture, and Trans-Europe Health, also part of this project, which basically started in 2020, and it was a little bit more than 1.5 years of project. But it's not only a project, as Monica was mentioning, it really had a political attention because the idea was that members of European Parliament has asked the EU to work on this topic. So this slide basically shows the key resources that the Culture for Health project produced. One of them is the Culture for Health report, which you can see on the cultureforhealth.eu website under Or Report. And it basically has 3 parts. One of them, we have taken the WHO 2019 report that Nils was mentioning. We kind of updated it a little bit, but also we added additional input to it. We widened the scope. While the WHO report talks about culture and health, the Culture for Health report also talks about culture and individual well-being and culture and community well-being. So how, as a society, culture is beneficial for our well-being. Can you go back a little bit still? Thank you. Also, very key and very useful output is the database that the Culture for Health project created. It collected more than 800 projects in this area. And why it is useful is that practitioners can go and search, for example, I'm working in the theater field, I want to work with youth, what kind of projects there are. You can take a look what is already happening. You can learn from those projects. And the idea here is not to reinvent the wheel each and every time in small projects across the EU and across the world, but rather learn from the other and already start from a higher level of understanding. And therefore, of course, get better and more efficient and actually have more impact in the end. So I really advise you, if you're thinking about having such a kind of project, to really take a look what is already out there and learn from the others. And it's also useful actually for policymakers or decision makers to see what is in their countries, because everybody, and it's still also possible to submit your project in this database. It will not be directly visible, so we have a curatorial, we look through, of course, what is submitted, but we are continuing to build this database, so please also submit what you are working on so that others can learn from it, and also that it, of course, gives you a visibility as well and shows, actually, on a European level, the vastness of implementation that is already happening on the ground. We also have a compendium, a guide for practitioners, and also when the war in Ukraine came out, we kind of triggered a discussion around how arts can support the mental health and well-being of forcibly displaced people, which became a WHO publication because also WHO then came on board, and also it has key action and call to actions in it. And of course, through all this work, we have been very much advocating for culture's role in, for example, the Comprehensive Approach to Mental Health, publication that the European Commission came out with, because we've been trying to advocate wherever possible, wherever we saw an entry point for culture and to make sure that culture is visible and as taken on board, actually, for example, when we talk about mental health or other fields as well. So now next slide, please. This is actually one of the key outcomes of the Culture for Health report. It's on page 7 of the summary report. So if there is something you can, I will point out what are the key important parts within the report. But basically, I'm not going to read out now here, but evidence shows from scientific databases that, for example, culture can help with resilience, empathy, improved mood, self-expression, empowerment, and on a community well-being level, there is evidence that it can help reducing stigma, it can help with social inclusion and bonding. This is not really new for the cultural sector per se, but what is new actually is that it's collected together and it is now kind of from scientific databases, yeah? So as I was mentioning, the very first part, it comes from the WHO report, which is about how culture can help in prevention and promotion and in management and treatment of illnesses. So next slide, please, to very quickly go through. So the second part of the Culture for Health report is about policy recommendations. And we have pointed out how actually the two sectors could work together. This is very much what Nils was talking about it. So we have the evidence, we need to act, and not only from bottom up, but now there is a need to work from top down as well in order to enable and create an enabling environment for arts and health to thrive. You can read the policy recommendations later because I don't have too much time, but I wanted to tell you about the first point, which if you go to the next slide, please. So one of the recommendations was that culture is taken on board in the comprehensive approach to mental health, which is an EU document to which actually the EU Council was answering. What does the EU Council is actually each and every member state states, so even the Polish minister is saying that participation in cultural activities can boost the overall mental health and well-being of people and reduce the risk of mental health conditions. So let's say if you have any kind of resentment within, it's actually on the highest level. This is agreed from the Polish side as well. So take this into account when you're talking to policymakers. Next slide, please. And last but not least, I'd like to highlight a very, very recent publication of Culture Action Europe. So we have worked with our members to a little bit add additional information and also feed the open method of coordination meeting that Monica was talking about that the member states are having. So we have gathered our members in series of online meetings and live discussions on working together on the paper, came out with a position paper of Culture Action Europe on how to bring the sectors together. This you can find on the Culture for Health website. Next slide, please. I think that's the end.
Thank you so much, Kornelia. And I'm very much also looking forward to your next presentation where you'll talk a little bit about culture, the Culture and Health platform. So I'm very excited about that. But for now, we have to move on. We want to move on. You've heard a lot about the theory, the research, the policy, and now we're actually going to get stuck into some real projects. So we have with us Marta. Marta is going to talk to us a little bit about culture on prescription in the Baltic Sea region. So Marta, could I ask you to come up to the lectern?
It's not that presentation, so another one.
Is that, it's
post-presentation, so sorry.
So should we switch around? Okay, in which case, Marta's going to come and join us again in a second. And I'm going to invite Paul to tell us a little bit about his project in Jersey, where I think you're doing some really fantastic integrative work also in relation to arts and culture on prescribing. Over to you.
Thank you. Good morning, everyone. I'm really grateful to be able to be with you and to be able to tell you about a project that we're working on in Jersey. Particularly thank you to Edita, who we actually met at a Culture Action Europe conference, and that's how we got talking about this project, and that's how I got the invitation. So a good example of the networking that's possible through Culture Action Europe. First slide, please. I need to give you a bit of context. So when you hear Jersey, and if I speak about Jersey outside of Jersey, I generally have to say that it's not the eastern seaboard of America, as you can probably tell by my accent, but actually we're a small self-governing island in the English Channel between Britain and France. I'm sure most of you knew that already, but just to clear that up. We're about 100,000 people, and on an island of about 45 square miles. We have our own government, our own political system, our own education and health systems. And I work for the government in Jersey. I'm responsible for arts, culture, heritage, and also social enterprise. A bit more context, next slide, please. Just so you got a picture in your mind of what it looks like. We're known for our picturesque coastlines, particularly famous for our cows and our milk, and also the Jersey Royal potato. So that's a little bit of what Jersey looks like, so you've got a picture in your mind. Actually, if you go back to the first slide, please. Thank you. So I'm here to talk to you today about a project that we've been developing and designing for the last 3 years. The project is called Connect Me, and essentially it is an attempt to install a social prescribing project at the island level, at the whole island level, across our population. The origins of the project were towards the end of the pandemic. The government of Jersey set up something called a social recovery fund, and that was in recognition about the ways that social isolation and disconnection during the pandemic was really impacting the mental health of our population, and the need to support projects that could help to reconnect people. And because I work in cultural policy, and I've been reading all the research that we've heard and seen today, I recognize that one of the most powerful vehicles for doing that was to create more participation in cultural and arts activities, as well as nature-based and physical activity as well. So our bid was basically a project to increase participation in arts and culture. We did some consultation work with people who worked in charitable organizations, community organizations, artists and art therapies practitioners, as well as people from other parts of the community, to try and understand how, having received grant funding for a 2-year pilot, we could begin to implement something like that in our island context. We didn't want to create something based on a model that was elsewhere and then try to impose it on Jersey. We're quite a unique environment, and we wanted to develop something from the ground up. So after all the consultation work, we essentially developed 2 parts to the system that we have begun implementing. The first part is called the Connect Me grant scheme, and it's a funding mechanism. I'll talk a little bit more about that. But the second part is a network of a group that we're calling Community Connectors, and I'll say a bit more about that too. So on the first part, in terms of grant funding, what we wanted to do was empower small community-level grassroots organizations to be able to either innovate and start new activity, which would involve people in culture and arts, or to be able to take things that they were already doing on a very small scale successfully, and to be able to scale them and apply them across the whole island, to increase participation in them. A couple of really important things that we discovered. Small amounts of grant funding that are very easy to access enabled people to be creative and to take risks. So we said we actually actively made it easier for smaller organizations to access the funding and to be able to experiment with small amounts. And then when they could demonstrate through collecting data and evidence that it was working to increase participation, then we would increase the funding that we were offering them. And that, keeping it small to start with, as I say, really inspired a lot of creativity. Through that grant scheme, we've now funded 154 different projects, everything from arts and crafts activities in care facilities, We have singers and songwriters going into schools and even into our prison and creating new music with the people there. We have nature-based activity where young people will learn to be creative in nature, and a whole variety of different activities that kind of fit across the whole spectrum of our society. When we put the funding bid together to get the project underway, we predicted that through these activities we would engage with about 2,500 islanders. And our latest recording of the data is that about 25,000 people have participated across these different activities over the last 3 years. So pretty much 10 times what we expected, and a quarter of the total population have been involved in some way. So that was the grant scheme. The next part was the Community Connector Network. So we recognized that simply creating a whole load more activity was not going to cover the whole objectives of the project and turn it into a social prescribing system. We needed those activities to be interconnected. We needed an interconnected ecosystem. And the way we went about this is we went to the organizations that we offered funding to, and we asked them, who is your most connected and networked person working with you or within your organization? Who are the natural networkers that you work with? And then, having had those people nominated, we gathered them together. There was 29. And we gave a small grant to their organizations to say, we want a bit of this person's time. And all that they were instructed to do was go into their communities and spend time listening and being on the ground, trying to understand what the needs were, what the gaps in provision were, and where were activities, where could potential activities reach new groups of people that were particularly affected by the pandemic. And then they come back together and they reflect and they co-create and they co-design. And from that program, we have had some really, really innovative projects that are reaching kind of new parts of the community. So those two parts together, the grant scheme and the Community Connector Network, and then from them we evolved the Community Connector Network and trained up some of the community connectors to be link workers. Now, I think about 3/4 of our link workers are actually practicing artists. So we're doing the prescribing work through artists and through link, training them to be link workers. If I had two important learnings from this project, things that really helped us, I would say number one was about partnerships with community organizations and trusting people who were already on the ground doing the work and empowering them to do more of it rather than trying to create a whole management structure over the whole thing. Partnerships was absolutely key, relationships. That would be the first thing. The second thing is that we tried to involve creatives all the way through the process, from the design of the policy, from the design of the structure, all the way through to the delivery of community connection and link work. Artists have been involved all the way through. We've had, our training sessions are often inviting artists to come and perform in training sessions, in the community connection sessions where they're designing new services. And that just ramps up the whole creativity of the whole project and gives it that relevance and that connection to what's actually going on in our communities. So those would be the two things that have most helped us through this process. I'd be very happy to talk to anybody else about how it all works, but for now, thank you very much.
Thank you so much, Paul. What a fantastic project, and thanks for giving us such a great overview of it. And I'm really looking forward to our discussion in a moment when we can delve into the details a little bit. But now, I think, we have Marta and Marta's presentation on arts on prescription in the Baltic Sea region.
Thank you very much. So first of all, I want to thank you, Bielsko-Biała, for inviting me here, because we are West Pomeranian region. We are one of the regions in Poland that believe that this is the time when Polish people should develop and implement AOP programs in Poland, because we also need the support of mental health for citizens of our country. And I would like to tell you more about our experience. Together with the other organization in our region, Media Design Association, we are implementing a project called Arts on Prescription in Baltic Sea region. And I have to say, when Odense region in Denmark came to us in 2022 and proposed us the cooperation in this area, we didn't know anything about social prescribing. And we took only one meeting to say yes to join the project, because we believe that this is a great time to connect, to build the bridge between culture and health sector. So this is a project which we're implementing since 2023 from the Baltic Sea program, Interreg Baltic Sea program, and this is a priority program of the strategy for Baltic Sea region. Next slide, please. So when we were creating the program, the project, we had three theses. So first of all, prevalence of depression and loneliness continued to rise among people in all ages. It was generally connected with the COVID and mental health crisis after COVID, but it's also connected with the economic crisis, ecological crisis, and of course now the war. Second thesis was that the health and social services and institutions don't have the capacity to answer all the needs, generally not only in Poland but in the Baltic Sea area. And we all perfectly know this situation, because each year there is like around 15,000 to 30,000 suicide attempts in Poland, only with people under 19. And we don't have enough space in hospitals or enough doctors to help them. And another one, and it was convinced today, that there is a political decision that we need to find this innovative solution to help people. And President of Bielsko-Biała confirmed that this is important also for Bielsko-Biała. Thank you. Next slide. Okay, so what we are doing in our project, first of all, we use the knowledge of all institutions which are sitting here, and also experience of countries like Norway, Sweden, and UK, to build our generic AOP concept. So this is a general idea about how the program of the Alzheimer's prescription should like, and it's also in Polish, so if you would be interested, you can check on our website, or website of the project or the West Pomerania region, and you can read how easy it is and to understand what is the concept. The second is practitioner guide. So this is the online tool which will be launched next year, which help people to create their own program. Another is the Rent an Expert program, because during the implementation of the project, we noticed that there are not many experts in Poland and other Baltic countries in this area. So we decided there will be a list of experts which knowledge you can use when you are creating your own AOP. And the other one are information materials, so you are able to find on YouTube the animation about what is AOP. It's also with titles in Polish. We have 2 brochures which generally describe what we done, what we want to do, and at the end we will also have the recommendation from the perspective of Baltic Sea region, but we already know that it will be also connected with the Ukraine, because during the implementation of the project we also involved the Ukraine. And the last one, it's not the least one, but it's a very important one. It's evaluation framework, because implementing AOP is one job, but another very important job is evaluate results of the program, because it helps us to convince stakeholders to put more money to the initiatives, and I hope that one day we'll be able to have enough money to implement project like for 5,000 people, not like for us it's maybe 30. So hopefully someone in Poland will be able to find money for this. Next slide, please. So the guide, because I think it's a very important tool. So you will be able to access 3 ways to get knowledge about the AOP. First of all, you could get there as a link worker. It's already explained what is link worker, but it's the person who is helping to organize such a programs, connecting culture and health, and getting the participants to the right program. Then you have the artists, culture workers, so the people who are, we call them art facilitators, who are helping people to understand their emotion, to develop their art skills, but first of all, help them to feel better. And the last one is decision makers, because we believe that, as I mentioned, now it's the time when we will raise awareness of decision makers to find support and money to implement programs like this. And here are the 6 areas in which you will find the information. The guide will be launched in 2025 at the beginning of the year, and as soon as we will have the final version in English, we will also translate it in Polish, so you will be able to read all the information in Polish also. Next slide, please. Okay, so the group which we decide to work with, these are people with mild mental health problems. And we use this word prescription as a tool to introduce what we want to do. But it's only vocal prescription. We only convince people just to come to us to talk about their problems, and we will help you to find the right program or find the right solution for you. And then we will offer them art activities. Next, please. Slide, please. Okay. So we have this general program, as I mentioned, because now we are implementing 7 pilots in 5 countries in the Baltic Sea area, 2 in Poland and 2 in Latvia, because the needs of these eastern countries of the Baltic Sea area are much bigger, as this subject is not so popular yet there. But generally, this should be activities for a group like 8 to 12 people, but we also involve a group of 20 people, and they loved it, so it's like only proposition. We also, based on the information which we get from the existing documents, we decided there should be at least 3 or 5 art categories, because people don't like all the art categories, so they should have a possibility to choose the one which they feel the best. And it's very important to have this program at least for 8 to 12 weeks, because it's this minimum when you will see the change in the people. As we are implementing now 3rd phase of our pilot, we know that you see physical changes in people after 5th week. So it's very important to have this 8 week to build the connection between people. And last slide, please. So I just want to mention, because we had this general idea about the program, but all the partners had a free possibility to choose with which group age they work. And we decided to work with young people, because we believe that this is the huge problem in Poland and in our region. So this is some photos and information about our pilot activity. And these are young people from a smaller city in our region, because we decided those young people in the big cities have more possibilities, and those in smaller city have the same problems and less possibilities, so we trying to help them to feel better in their life and solve their problems. And what is also important and connect us and Odense region, which I mentioned in the beginning, that we involve also immigrants as a participants of our program, because this is now immigrants from Ukraine are a very important part of our society. Thank you very much.
Thank you, Marta. Thank you for that oversight and for your great work on a great project. Again, I think two really fantastic projects that we've heard about, different but with similar levels of quality. We have about 20 minutes left now, and we would really love to have a conversation also with you. We'll be talking, I'll be asking some questions to our panels, but we'd really love to have some questions from you as well. So if you have something in your mind now and you want to let us know, then do think about that. We're more than happy to take questions in Polish, and we'll have them translated. In English, I think we have other languages here as well. We've got French, we've got Hungarian, we've got German, Portuguese. So whatever you feel most comfortable in, I think we can probably handle it. But it's often a little bit difficult to get. So let me just take the temperature of the room. Is there somebody who really wants to fire out a question right now? Somebody got a question right on the tip of their tongue? All right. Well, then what I suggest we do is we take a minute. Sorry? Did I hear something? No. I suggest we take a minute, and maybe you speak with your neighbor, person to the left, person to the right. If you're sitting on your own, maybe you find somebody, and you just have a quick chat about what you thought was interesting, and maybe start articulating a question that you'd like to ask to the person sitting next to you. So we'll just take a couple of minutes, and then I'll bring us back in the room, and if you want to ask that question, feel free to do so. So we'll just give ourselves a couple of minutes now. Feel free to talk with your neighbor about what you thought was interesting and any questions that you might want to raise. Okay, I'm going to invite you all back into the space to join our conversation here on the stage. I saw some really good engagement. I saw some people having really good discussions, especially there in the middle. I saw some good discussions. Does anybody have any questions that they started to talk about with their? Oh, I saw one hand. Is there maybe another hand? So we can take a couple. Oh, perfect. Okay, we've already got two hands lined up. That's fantastic. Please, yes, for the microphone, Edith.
Thank you. This is especially to Paul, because you said you give incentives, small grants, and then you make out of who is evaluating then what the outcome of this let's call it pilots, but you also follow them up if they're successful, and who takes over the financing, the organization of these projects?
Yeah, okay. Yeah, so the way it works initially is they will apply through a grants application process. And then, so we're a team of 6 people working in the government, and it's a mixture of 2 different departments. So we've got people in the, essentially the social security department, which liaise with the charitable sector, and then in my department, which is economy and arts and culture. And so that team evaluates every single application, and we come up with a unique set of KPIs of performance indicators for each project based on what they're trying to achieve. They will go away, spend the money that we've given them, and then they will have to come back and report in order to access the last part of the grants. We'll hold back 25% or something like that. And then they will report on the KPIs that we've collectively decided upon, and then we provide the opportunity to advance into a greater level of funding. So that's the way it works, and the reporting mechanism is managed by a small team. Yeah.
Thanks, Paul. That's really interesting also because you're saying that you're co-creating the key performance indicators, the KPIs, as opposed to putting that burden on the applicant. And I guess that's in line with your philosophy of trying to make it as easy as possible to access and apply for that money. Is that right?
Yeah, we recognize that if we were going to get creative things happening, we had to make it easy for people who were almost doing it either kind of informally or very, very small community organizations. So the admin burden of the usual grant application process, we knew we had to relieve some of that. And the idea with unique KPIs for each project is just that you don't apply kind of a blunt measure to all the different projects to achieve certain outcomes. So they can actually define what they're trying to achieve, and then we can design the way to measure it.
And sorry, one final follow-up question. Are there kind of health metrics involved in these? Are there any kind of health-related questions that you might be asking?
So there's 2 sides to it. So the projects all have to demonstrate how they are increasing cultural participation or physical activity or outdoor nature-based activity. We don't ask the project owners to say how that's going to help people because we've got all the research that helps people. But what we do on the other end is then we are starting to research the impacts of the project. We had some interns join us over the summer, and they went out and did surveying for all the people many of the people who've been involved to try and get a sense, and it's all relatively subjective, so it's self-reported levels of well-being. So how did you feel before the project? Has it impacted your well-being? And the results were really, really encouraging. Vast majority of people said it had either been helpful or extremely helpful for their well-being. So the next step for us is to do a little bit more rigorous quantitative data, and we're particularly interested in the economic return on investment. So how much are we saving our health service? That's the next step.
Thank you, Paul. I'm going to ask you as well, Marta, because you mentioned evaluation as well as part of your presentation. Can you say a little bit more about how you evaluate the projects?
Yes. 3 universities, one from Finland, one from Sweden, Denmark, and one from Poland, create this evaluation framework, which we used with the participants. So after each of the activity, they are asked to write us if they like the activity and if they it influence on them somehow. Because as we are learning now, we also looking for the right type of the art activities who will help this group age. And for example, we noticed they don't like to be evaluated alone, so they didn't like to singing classes, for example, but they love all the art activities connected with the theater. When they can make short performance work with actors with the breathing exercise. Another activity is that they are filling the questionnaires at the beginning, in the middle, at the end. So we are able to see the change in their behavior and health. So that's why we know, for example, that 1/3 of our group think about the suicide every day. And it was also surprising for teachers, because they didn't think that those young people are so focused on their problems that they don't see the future from themselves. And we have also the third activity, which is at the end of the pilot, and it's more creative. So they are voting what they liked in the program, what they didn't like. They are describing their feelings, what have they changed in themselves. We are using the special cards, which was gave us by the Finnish partners, and we are talking with them. We have this evaluation activity when we are talking with them by an hour and a half about how they experience what was changed, how they feel about their future. And then all those information are sent to 3 universities, and they are collecting all the information and creating one report which will show the results of our activities, just to support also this idea that we should implement such activities generally in the Baltic Sea region. And this report will be present First part of the report will be presented in 2 weeks' time in Brema, and then the final version will be ready next year.
Fantastic. We'll look forward to seeing that. Thank you, Marta. I think we had a question. Yes, you already have a microphone.
Yes, I already got the microphone. Thank you. I'm Tomasz from Małopolski Institute of Culture. And because I work in culture sector, I more or less know how to involve culture organizations and people. I just want to, maybe I take it too literally, but I'd like to elaborate a little bit more on how to involve health sector and how the process looks like. This prescribing, for example, who does that actually? At what stage this prescribing actually happens? If you can elaborate a little bit more. And I'm also interested especially with the Polish example, because we are working in the region, in Poland, so we also can copy things from our best practices in our country too. So that's very process-based question. Thank you.
That's a fantastic question. In fact, it was a question that we had prepared earlier in case we weren't going to get any audience participation. This was one of the questions we were going to ask. Thank you. I think there's 2 parts. One of them is, maybe I'll direct at Monica in the first instance, and also at Kornelia, to say a little bit more about how do we involve the health sector. I mean, functionally, but also philosophically, spiritually. How do we manage to break down some of the silos and get health involved? I don't know, Monica, you have been working at this for a while and been successful in cases as well, especially now with the OMC, I think, where you're doing a fantastic job of getting health involved as well. Can you say a little bit more about the challenges and maybe ways in which we can surmount them?
Yes, sure. From at our level, we have seen that there is a huge need for translation. So, you know, including myself, when I started working on this, I had this purely cultural angle, and I thought, okay, of course, culture is essential. Of course, the intrinsic value of culture doesn't need any argument. But then you have to put yourself in the other sector's shoes, collective shoes, and think, well, but they are the health sector, they don't know that. Or maybe they know it partially through personal experience, or maybe they don't trust it, they don't believe it. So, and it's the same thing when you go for funding. We have seen this at the European level because we have done this mainstreaming process of culture in different fields. Like, you know, you have funding for culture in regional policies, you have funding for culture in research, you have funding for culture in even agriculture policies, for rural heritage, whatever. And it works very in a difficult way in the beginning, because you have to, the culture sector or the culture policy makers have to take the lead and take the burden on their shoulders and try to adapt to the other interlocutor, which is not at all manipulating, culture or trying to present it as something that it's not. So we have to keep our, vertical, our values, and at the same time understand what the other sectors need from us and how we can collaborate and meet in the middle. But right now in the OMC group, we're going through this process of translation, explaining each other, what are the borders, what are we going to do, what we are not going to do, and what we can expect, and what's in it for them. I think it's a basic marketing principle. Also, how we can support this sector while keeping our intrinsic soul.
Kornelia, did you want to say a couple of words in addition?
Yes, thank you. Very well, very much agree with Monica about basically looking at the priorities of the health sector, looking what are the priorities for them, and try to find entry points so that a little bit try to find and speak their language so that they understand how to link it to them. First, of course, we are going towards the priorities, and later on maybe we can also change those priorities. That's the next step. But to get the understanding, it's also very good to start from their priorities, to get your foot in the door, let's say. I always say that you have to talk about this idea at least 5 times to the person to really get it, so that they really get it. Unless they are practicing themselves some kind of cultural activity, you shouldn't think that if you went once and been thrown out, that means that the person is not interested. Maybe they just didn't fully understand the process you are going through them. And also one important trick is if you go with the Culture for Health report to the health sector, maybe that's not an ideal thing, because they understand World Health Organization. Go with the World Health Organization report to convince them. So that's also good to really also find allies within the health sector who fully understand what we are talking about and ask them to bring it up to a higher level. So, of course, from within their community, they understand better how to scale this up. And one interesting story that I just heard 2 weeks ago, that someone also on Arts on Prescription from Lithuania, they went to the health sector and they had all the evidence and everything and was very prepared for the meeting to convince. And then after 2 sentences, they were stopped. We are convinced. Just tell me how to do it. So you already have to know what the process you want to take them through. Because maybe some of them are already convinced. They just don't know how to, crack the nut.
That's a great segue into the second part of the question, which is how? How do we implement social prescribing? A little bit more detail. So I'll come to you in a second as well, Paul, but I guess given the Polish context, Marta, maybe you can say a little bit more about the guide that you're developing, which I guess will be a big help in answering exactly that question.
Yes. Unfortunately, I have to say that we didn't manage to get to the health sector. And when I say we, it doesn't matter only Polish partners, but it's also concern all the partners. The only partner who are using health sector as link workers or referral channels are colleagues from Germany. But we plan to have a special event for the ministries of health sector from all Baltic region next year, when we have all the results, and we will be prepared to show them how to do this, because this is what Kornelia mentioned. It's important to show them how to do this. But in the meantime, we are already starting the process to building this bridge between health sector and culture sector. Next week in Gdańsk, we'll have a panel also about the culture and health, and we will have a doctor, so the representative of other side, who will speak about how important is culture in health sector. So thanks to those small initiatives and those ambassadors, we hope that we will be able to, at the end of the project, convince health sector that this is important issue. And what we already discussed also with other institutions in Poland is that maybe we should focus on the new generation of doctors, because we have lots of medical schools, and maybe it would be easier to convince those young doctors to use these tools than those who are already on the market. So we have medical school, Pomorskie has a medical school, I don't know if Bielsko-Biała has medical school, but those three voivodeships can work together and find the solution for whole Poland, I hope. I don't know if that answered.
Thank you, Marta. And we're beginning to run out of time, so we only have a couple minutes left. But Paul, maybe you can say a little bit about the mechanics, as it were, of social prescribing.
Just to echo a point about people not getting it, I think we had to present to politicians 5 times before they understood what we were actually asking for. And each time we had to go away and slightly tweak the presentation, change the language a little bit, come back. But it got there in the end. And also about the younger doctors. I think what we have to recognize is that social prescribing is essentially a movement for systemic change. And it's a totally different way of thinking about health within communities. And within any system, there are change makers. They're sometimes hard to find, but they are there. And so we've been trying to identify the change makers within the medical system. We currently have 14 GPs who are signed up to be part of this prescribing system. So there's 2 routes to being prescribed, or we prefer to use the language of referral. Mm-hmm. So either you go to your GP or frontline medical worker, whoever it is, a social worker, and they have access to a system that we've implemented where they can see the full marketplace of all the activities that are available, or they can refer somebody to a link worker. The community connectors are also doing that work of referral to a link worker. The link worker then takes a look at the individual, their need, and all of the activity on the marketplace and tries to matchmake what that person needs with what's available, and then supports them to make sure that they are able to access that activity. So that's actually just being implemented right now, and the system is going live from January. So we're kind of in the early stages of that. Mm-hmm. But that's the way it's set up to work.
Thank you. And just to say, this is actually a very complicated question, because the system itself, social prescribing, culture on prescription, arts and health, community referral, all these concepts are still evolving, and they're evolving in different ways in different countries. Greece is just piloting a nationwide social prescribing, or actually cultural prescription process that is going through electronic referrals. We've got Austria piloting projects. The UK has a quite integrated approach already. We've heard of some examples here. Were you raising your hand? Yes, okay. Oh, so I shouldn't drone on. Let me pass over to Monica.
Just to add as an example, and I do encourage you, Tom, and everybody here from the Polish, among the Polish representatives, to use the European examples that you have from other cities, from interregional cooperation, or Jersey. For example, in Greece, Greece has applied with a project on a national-wide culture-based social prescribing, particularly focused on mental health, with recovery and resilience funds. So it means everything is possible. Indeed, you have to find the right person and the right ambassadors or allies or whatever we call them, but it is moving forward. So I really trust this process.
Exactly, and I think the important thing is that there are resources out there. So I think I put a link up to an existing social prescribing toolkit that WHO published. You're publishing something. There are plenty of resources out there, and I'm happy to refer people to those in the break if you want some more information. But we've come to time, I think. We're in fact a little bit over time already. So I wanted to draw this to a close. I wanted to say thank you very much to our panel, of course, for the wonderful insights that you've given us, the kind of high level and the bottom-up work that you're doing, which is fantastic to see. But I also wanted to thank all of you for listening, for your participation, for your questions, and for being on this journey with us together. I really hope we continue. Thank you so much.
Thank you. And now if Kornelia can stay with us and tell more about the Culture and Health platform, Culture Action Europe.
Yes, thank you very much. Actually, just still following on the previous panel, some help that can also help you with convincing the health sector. Within the Culture for Health report, after the policy recommendations, you have these 8 challenges that are highlighted there. That was exactly put there also to show politicians. Often politicians say, what you're saying is very nice to have, but we don't have money. And just taking their challenges, like, for example, aging of the population and so on, and showing how cultural activities can help or contribute to the challenges that they are facing, is again linking to this what's in it for them kind of attitude. So one thing is that you can use the 8 challenges part of the Culture for Health report, but also of the Culture Action Europe position paper that I was presenting that has a part actually about health language. We have some keywords highlighted there. For example, equal access to health is a very nice way of approaching the health sector, which is actually very much connected to access to culture. So if you are using that word, equal access to health, then they might get it earlier. So another thing that what I wanted to add to the previous panel as well is there is the arts and prescription, social prescribing model, but you can also just pair institutions. For example, if you're pairing an elderly care home together with a conservatoire, the elderly care home needs activities, cultural activities. A conservatoire needs an audience to actually train their musicians. It's basically costless, and that, of course, but it is benefiting both sides. So you can also start just by connecting in the other side, outside of the cultural sector, and benefit also people in that way. So this part of my presentation will be about the Culture and Health platform that has started 1st of November, so it's very new. You can find a little bit of information about it on the Culture Action Europe website, but we are building the communication up. As you know, it's only November the 15th, so more information will be coming. Can you put the next slide, please? So I was promising a little information about Culture Action Europe. So we are a major cross-sectoral cultural network. We have over 240 members. Some of them are individual members, some of them are international networks, some of them are regional networks, cultural organizations, so really all types of organizations are welcome. And basically, we advocate for culture and the arts. We connect and facilitate and exchange in dialogue. We co-create and share knowledge and lead projects and campaigns. Next slide, please. So we basically have these 4 action areas, which is capacity building, advocacy, knowledge sharing, and knowledge production. And if you go for next slide, please. This is our strategy as agreed with our membership, and it was really a bottom-up process building this. These are our key lines of working for until 2028. And as you will see, I think you push one button. the culture, health and well-being is part of it. I also wanted to highlight that in our conference in Greece in 2023, we really together established the CARE principle. So we really want to, CARE is a strategic pillar of Culture Action Europe, and it's also care about the cultural ecosystem that is sustainable, inclusive, and democratic. So we've been working on this topic for quite a while, since at least since 2016, yeah, basically through what we have the strategic line, and we are trying to find, of course, funding that matches it. So it's better to have the strategy and then find the project that matches it. Next slide, please. So this is just to come back again to the Culture for Health report and all the impacts that cultural activities and engaging in culture can give. And if you go to the next slide, please. I'm showing you the policy recommendations now of the Culture for Health report. And what is marked in yellow, we have been trying to answer with the Culture and Health platform. So basically, it's about financial support to emerging artists working in the field of culture, health, and well-being. It is about raising awareness on the evidence. It is also about training and peer learning in this area. And it's about supporting a dedicated platform of exchange. So if you go for the next slide, this kind of shows the next 4-year project that will be basically the basis of our work as well. So it is a platform which aims to promote emerging artists working in the field. We are providing financial support for artist-led projects. There will be so-called national calls, and there will be also EU-level calls. So that it's really accessible for everybody. But our trainings, for example, will be online, fully accessible for all kinds of, for people from all around the world. Well, of course, mostly EU. But we also enable mobility, so we will have some shadowing activities, for example, where from one country an artist can go and learn from another country working in this area and seeing it for two weeks what he's doing. It's a little bit like a residency program, but not that long, but shorter version. Of course, we are increasing awareness and networking opportunities. So the aim is to support 200 artists in those 4 years. And if you go to the next slide, please. Here are the countries that are members of the platform. You see that Poland is not there, but that doesn't mean that Poland cannot be there, because every year we are actually opening up the platform for new entrants, and we are in discussions with people here in the audience of how to have Poland on board as well to the platform. But again, those who are not, so in countries where where we don't have a platform member, from those countries also artists can apply to the European level calls and be part of the training activities. And one very important activity, if you can go to the next slide, please, is that we are also going to provide peer learning and knowledge community. So we are sometimes all isolated as artists or cultural workers in this field, and what is possible that we are basically opening a Zoom and artists are open to share their experiences or also their difficulties, and we will provide trained psychiatrists, psychologists who can help that process as well. I'm not saying that they will get a therapy or anything like that, but at least a sharing of experiences and asking how other artists or cultural workers were handling that, that is already an experience that is very helpful for them. So as I said, we will have national level calls. It's not that we have tons of possibilities, so it's not like a panacea of funding. So we would have 3-4 artists per country, but we also have EU-wide calls where we have 8 artists selected in 3 years. We will support and build artist capacities. There will be a lot of online trainings. Also, for example, awareness raising for the health sector will happen. So if there is such an online event, you can also reach out to the health sector or your social sector colleagues whom you kind of happened to maybe convince to be part of that, that information session. So we really want to get also to the people, to everyday people, what Nils was mentioning, that engaging in cultural activities is actually a health behavior. In the 1950s, nobody thought that actually physical activity is good for your health. And now it's common knowledge. We should reach that each and every person knows that engaging in cultural activities is good for your health. So yeah, lots of work for us to do there, for you to do there. So I'm asking you to become change makers and help us in this process. Next slide, please. So things that we already know that is coming up, but it will be all on our website soon. So probably on the 4th of December, but it might be 1 or 2 weeks later, we will have an online launch of the platform, giving a similar information session that I'm giving now, with also some information session of how to work in a health environment, or how to, for example, use the CHIME methodology from psychiatry as an artist or a cultural worker. And we will repeat that online session with more information in January, and the first calls will be coming out in February in the national level calls. And thereafter, we will, of course, as I said, have online trainings, and these knowledge communities will start. We will continue our awareness raising and the shadowing opportunities. And one key conference that we will have is October 2025 in Finland, which will be the first showcasing event of the platform. And I'm so happy actually that Bielsko-Biała conference, which happened to be in the start of the platform, also gave this opportunity to tell you about this platform. Next slide, please. I think it's ending. Yes. If you have questions, let me know.
So thank you for this insightful first part, and now I will invite you for a short 20-minute break, and we resume in 20 minutes, 11:35. Thank you. So slowly we'll start the second panel. I have